I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on why thyroid eye disease is difficult to diagnose. Well, firstly, we call it thyroid eye disease. I still refer to it that, but it's really immune disease of the eye sockets related to thyroid dysfunction or immune dysfunction associated with thyroid disease. Really complex names. Simple names are Graves' disease, Graves' eye disease, but generally people still refer to it as thyroid eye disease. This is difficult to diagnose because in fact it's an immune disease. You can have normal thyroid function and have thyroid eye disease. What do I mean by that? Patients will come in and say, oh, my doctor checked my thyroid and it's fine. But in fact what the doctor's done is to check how the thyroid gland is functioning. Your thyroid gland can function normally and you can be what's called euthyroid and you can suffer thyroid eye disease. In fact, not an insignificant number of times, percentage of the time, thyroid eye disease comes on before you have thyroid disease. So people can just develop sudden bulgy eyes and never have had any thyroid problems and have normal thyroid chemistry. So they do present separately, and that makes it difficult to diagnose. The other thing that makes it very difficult to diagnose is thyroid eye disease presents in so many different ways. It can present with a stare, with puffiness, with ache, with dryness, with wateriness, with a bulge, with double vision where the eyes are crossed. So many different ways. And it's quite often confused for allergic eye disease. Most thyroid patients at one stage in their life have been told, you have allergies, you have allergic eye disease. You don't. You have an immune problem driving inflammation around your eyes that we call thyroid immune orbitopathy. So because it can present so variably, because it can present slowly, because it can present without thyroid problems, thyroid eye disease is often misdiagnosed. So don't be upset if that's happened to you. It is all fixable and it can be brought under control very quickly. Just be aware that if you're told you've got allergic eye disease, you may not. You may have thyroid eye disease. I hope that all makes sense. Thanks for watching. I'm Dr. Anthony Maloof from Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney.